Today my guest is Sandeep Jauhar, a cardiologist who's written a series of books about his profession and is a contributing writer for the New York Times. Sandeep Jauhar, welcome to the Drexel interview.
Thank you for having me.
Well, I'm a great fan of your work, both because of the eloquence of your writing and your insights, and because I have both 2 children and a husband in medicine, and much of what you say dovetails with things that they say. So I'd like to start with your second book, Doctored, The Disillusionment of an American Physician.
I would go to the doctor's lounge and I would hear doctors complaining bitterly about medicine and the way it had to be practiced. And it occurred to me that they weren't complaining about the paperwork or the money or the usual things that people point to. It was an existential crisis. They were unable to be the kinds of professionals that they had aspired to be when they were younger.
And you give the example of your father coming in with shortness of breath and then seeing 15 specialists. But a nurse was able to resolve just by looking at the case as a whole. That, to me, is just appalling.
Doctors are running on a treadmill, and they don't really have the time to get deeply into every patient's case. Someone comes into your office with back pain. 90+% of cases, it's going to be just from occupational stress or lower back pain, benign, and you can exclude it through a careful history and physical exam. But it's sometimes just easier, your appointments are 7 minutes apart, just to order an MRI and say, move on to the next place in this conveyor belt, and I'm going to start seeing the next patient. It's just too easy to do that. And I think that's one of the reasons why American medicine has gotten so splintered.
Your book, Heart, which is a history of the complex and mysterious organ of the body. Tell us a little bit, just to do a little history, how was heart disease handled before the late 19th century?
So the heart had never been operated on as of the late 19th century. Every other organ in the body had been. And,
why is that?
Well, the heart has some unique challenges. It is probably the most metaphorized object in human life. This is the seat of the soul, the repository of the emotions. There were sort of cultural taboos associated with manipulating the heart. But scientifically speaking, it's really very, very difficult to suture something that's moving the way the heart is. Secondly, it's filled with blood. So if you cut it open to fix something, you'd bleed to death. If you stop it and drain it of blood so you don't bleed to death, you suffer brain damage.
You talk about something else in your book that fascinated me, which is the way in which emotion can affect the heart.
This emotional stress, in ways we don't really understand, can cause the heart to acutely weaken and change into a distinctive shape that resembles a Japanese octopus trapping pot called a takotsubo. So it's called takotsubo cardiomyopathy. And in many cases, patients get better, but in not a small minority of cases, patients can actually develop life-threatening arrhythmias, congestive heart failure, and actually die. I had a patient, and I wrote this about this in the New York Times, a woman whose husband had died after a long illness, and she was probably a little relieved because it was a long illness, he had dementia. A week after the funeral, and all of a sudden, she couldn't breathe, chest pain. We did an ultrasound, and the heart had acutely weakened to less than half its function. And then a few days later, when her emotional state had returned to normal, so too had her heart. In my field, congestive heart failure, I deal with a lot of death. There's a patient who I wrote about in Heart who passed away, and the day he died, I remember thinking that I had experienced enough death to fill up a lifetime. It's one of the most difficult aspects of the job, but the way that family supports patients near end of life is something that I am constantly amazed by.
Well, I look forward to reading you in the years to come. I want to thank you for being here today.
Thank you very much.